Hello, I'm Erik Garcia, acute and family nurse practitioner. I will be presenting a Insomnia Screening tool evaluation today with video and PowerPoint. This is for the University of Texas at El Paso Doctorate of Nursing Practice Program Cohort 11 with Hector R. Morales, DNP, APRN, PMHCS-BC, and the Advanced Diagnostics course. So go ahead, it should take about 15 minutes. We'll go next into the overview, but first, don't forget to check out this cute dog. Ha. Hi everyone, here we'll have the overview. As you can see, we'll start with the importance of insomnia diagnosis right under the different screening tools. They are listed here. If you want to review the acronyms, then we'll discuss the treatment and recommendations for different patient groups, and we'll have a nice little CBT, cognitive behavioral therapy video. Cheers. Hi. So again, we're going over importance of insomnia diagnosis. I took an epidemiological approach, as you can see here. I listed 3 things to complete the entire triangle. So with this, let's think about the agent on top. We'll have host over here in this corner and environment over here. Ultimately, agents is insomnia itself. The host is the person. This is a broad range, and environment has a lot to do with it. So ultimately, agent, right, insomnia. Turns out there are several different types of insomnia. So if the diagnosis is incorrect, as we might diagnose initiation insomnia versus chronic or late insomnia, meaning they wake up later, these are different treatment options, right? One's to fall asleep, one's to stay asleep. If we miss this diagnosis by improper screening tools and just bad habits with our patients, it's going to have a big difference in the treatment plan, of course. Ultimately, many of the treatment plans do overlap, fortunately, but after initial response, no success is done. 2-3 times later with adjustments may not be successful if the initial diagnosis is incorrect. So it is vital to have the proper diagnosis. So here, next slide, ICSD-II. We have the diagnostic criteria all listed here. You can go ahead and reference this. This is from their website. Many of it is in different languages as it is international. Pretty generalized symptoms here. It asks for the patients to list them, as you can see. So let's get a little more into this. We'll go with the patient group first. This does work for all age groups. Pediatrics, geriatrics, doesn't matter your gender, ethnicity, anything like that. We need to find out though if it is a independent disorder, meaning insomnia stands by itself, or are there underlying condition and comorbidities, especially other psych disorders such as bipolar, anxiety, depression, PTSD. These psych disorders will weigh harder in on insomnia. Also, some of these disorders can lead to insomnia, not just including psych disorders, but let's say hyperthyroidism. So if these underlying conditions aren't addressed first and foremost, it doesn't matter about the insomnia. The insomnia may resolve secondary to the cause of it, right? So we have to make sure it's an independent disorder, as you can see down there. And this one's a little more for the clinician. We give them a screening tool, a survey, we get it, and we provide a diagnosis. This isn't so much as to them feeling they got better or not. Excuse me. This isn't for them to feel if they got better or not. It's for us to be able to judge and make a diagnosis at a cutoff. Recommendations are to treat the underlying conditions initially and also try cognitive behavioral therapy, and we will get to a video of that later if you do not know what that is. Cognitive behavioral therapy seems to have been a staple on the recommendations for all of the guidelines and screening tools. So we'll go ahead and hone in on that later on as well as addressing underlying conditions and psych disorders and proper diagnosis, whether it's initiation insomnia or maintenance insomnia. Okay. Now we've moved on to the Insomnia Severity Index. As you can see, I have gone ahead and left you a chart here so you can review. Moving on to it in discussion. You can go ahead and pause that if you need more time. This is good for all patient groups. It is sensitive for detecting changes in the patient's perception. So it is a good marker, in my opinion, to see how the patient feels they're progressing and how they're doing with the treatment, how bad it is, and hopefully it should have some positive trends. If not, we have something to look into. It is a self-reported screening tool, and I will include 2 self-reported screening tools, the Insomnia Sleep Index, as well as the Pittsburgh Sleep Quality Index, which we won't go over. It is very simple. It is a self-reporting tool just like this ISI. It's also good for all of the age groups, and it has a similar recommendations of addressing underlying conditions as well as CBT therapy for initial therapy prior to any medications. And of course, proper diagnosis is key. Not a lot of room in here, but DSM-5 here. Got some criteria, another straightforward one, more for the clinician on basing a diagnosis off of it. Interesting stuff. So more into the DSM-5, this is a psychiatric-based diagnosis. It is for all age groups and ethnicities, patients of all types, really not discriminating against anyone here. It is more clinical in diagnosis and needing a diagnosis. I do like how it goes into identifying whether it's initiating sleep or maintaining sleep. Most of them are onto that, but it's one of the big factors we need to keep into mind in dealing with any type of insomnia. The recommendations for this one as well, as you can see, cognitive behavioral therapy, as well as addressing any comorbidities. It's pretty straightforward across the line here. I am primary and acute care based, and if these initiation therapies don't work from my standpoint, we would be going to a specialist. So, for discussion, what do all these things have in common? A lot of different treatment options. We can try medications. They usually start with melatonin. Regardless, initiating sleep is very common to have melatonin assist them. Staying asleep would need an extended release. But prior to even melatonin, CBT therapy is the way to go. This is cognitive behavioral therapy, as well as addressing comorbidities that may be addressing the issue. So basic health screening is always great. You need to assess properly and get a proper diagnosis. These things seem to hold steadfast throughout all studies and recommendations, and we will continue to use them. Since it was such a staple in this, I would like to go ahead and take some time and focus on some cognitive behavioral therapy videos here, or a video, I should say. This video may not work on a hyperlink, but you can go ahead and copy and paste that or just type it in. It's not very long and it should take you to a CBT video. If you can't find it, there are plenty of good ones. Start with the shorter ones on just an intro, and we can go through it together. Learning is always a good thing. And here we are in the summer. And finally, the summary. I know what you're thinking. Wait a second. We never went over the Pittsburgh Sleep Quality Index, right? I know, it's a lot like the ISI. It's a self-assessed tool. You reassess in about a month, and it's subjective to the patient, see how they're doing, and it's a good assessment tool to see how the treatment plan is initiating and working for them, which is why I also wanted to include it. I included 2 more clinical diagnoses for us to be able to treat as providers, and 2 for the patient to be able to report back, and we can kind of track their progress, right? Those were the different screening tools. I think all effective, could be used simultaneously for added effort, but you don't need all of them. There were also very many more. I'm sure you can come across more. These seem to be the more common and researched ones, so I went ahead and went over them. Discussion for patient groups. What did we notice was all steady? It was a cognitive behavioral therapy as well as checking comorbidities. So a good physician screening, psychiatric or not, even a primary can do some good screenings to rule out any other underlying conditions that may be causing the insomnia, as well as the cognitive behavioral therapy before even initiating any medications. And then we'll go over a video over cognitive behavioral therapy, which I think would be beneficial since it's such a mainstay in the therapy of insomnia here.